Hello everyone, coming to keratoconus. Keratoconus means kerato means cornea, conus means cone shape. It was also known as the conical cornea. Etiology is the firstly cornea is a structure which was maintained by the elastin collagen fibers. So any congenital weakness in the cornea may lead to this keratoconus, usually manifested after puberty. Secondary causes are trauma, any Down syndrome condition, or vernal conjunctivitis. In vernal conjunctivitis, due to irritation of the eyeball, there is a rubbing of the eyeball which may lead to the keratoconus condition. Signs, there are three types of. Coming to the signs, first sign, there is a bulge in the cornea. The bulge is due to the thinning of the cornea at the center. In this condition, the apex of the cone, which is slightly below the actual center of the cornea. Next is the myopic astigmatism. Myopia is caused due to increase in the axial length of the eyeball, and astigmatism is due to change in curvature of cornea. Next sign is Munson sign. In this sign, when the patient asks to look down, there is a bulge in the lower lid. Next, in less advanced cases, there is a loss of cornea reflex is seen. Coming to the investigation, firstly, corneal thickness can be measured by the ultrasonic pachymetry or OP scan too. Nextly, droplet of oil can be seen, which can be elicited by the examiner and on the patient. The examiner and the patient should be sit apart of 1 meter distance. In this mirror, examiner has taken a mirror or ophthalmoscopy, and the mirror is moved forward or backward. The result says that a ring of shadow or concentric with the margin can be seen. Why there is a ring of shadow? It's due to that as the mirror moves forwards or backwards, the rays that enters the eyeball of the patient and emerges through cornea. At the center of the cornea, there is a convergence of the lens rays, and the peripheral there is a divergence of the rays. Next sign is Vogt striae. It was due to the examined by the slit lamp examination. In later stages, the apex will show the fine striae or lines. Next type of sign we can elicit is the Fleischer's ring. It is a brown coloring basically, and the hemosiderin deposition. Lastly, we can elicit. Coming to next sign of cornea, in this the cornea is usually the 5-layered structure, but recently 6th layer was added. The 5 layers we can know are epithelium, Bowman's layer, stroma, Descemet's membrane, and endothelium. Due to rupture of Descemet's membrane, there is an entry of the fluid into the stroma, which makes the stroma edematous. This condition is known as the acute hydrop. Last and final modality is the treatment. In early stages, vision is improved by the spectacles and contact lenses. Contact lenses are most beneficial than spectacles, which eliminate the irregular curvature. And a new treatment is the corneal collagen cross-linking. In this, first, there are 3 simple steps. First, the riboflavin of 0.1% is added to the patient's eye after 3 minutes, for a duration of 3 minutes after removing the epithelium. Then UV radiation is projected, and lastly, placement of bandage contact lens, which permits the healing. Why riboflavin is preferred? It is a photosensitive agent which triggers increases the cross-linking of the collagen fibers, helps in formation of the interfibular bonds. Other type of surgery procedures are keratoplasty. It is help in the progressive conditions where there is a progressive visual loss. Present known technique is a deep anterior lamellar keratopathy. Here there is a removal of entire corneal stroma without disturbing the endothelium and the Descemet's membrane, helps in the prevention of graft rejection of cornea. Thank you.